All right, I'm going to call the meeting to order. We'll let Mr. Bush get settled in. 2.0, prayer.
Yes, ma'am. Let's pray. Lord God Almighty, thank you for this opportunity to once again come before you and serve the people of Stephenson County and our county nursing home. Pray that you help us make good decisions, that we communicate well, that we think through things and do the best that we can for the folks that live there and work there. And, always with in mind that it's the county that's responsible for the overall operation. So we thank you and praise you in Jesus' name.
3.0, approval of tonight's agenda. Do I have a motion to
So
approve?
moved.
By Mr. Bush, do I have a second?
Second.
By Mr. Whalen, any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. 4.0, review and approval of meeting minutes from November 7th.
So moved.
By Mr. Bush, do I have a second?
Second.
By Mr. Whalen, any discussion on the meeting minutes? Seeing none, all those in favor say aye.
Aye.
Opposed? Motion carries. 5.0, approval of claims totaling in the amount of cash requirements and manuals of $235,442.87. Do I have a motion to approve?
So moved.
By Mr. Bush, do I have a second?
Second.
By Mr. Hadley, any discussion? Seeing none, all those in favor say aye.
Aye.
Opposed? Aye. 6.0, public comment. Do I have a public comment? Nope. All right. Moving on, 7.0, reports to committee. 7.1. Administrators, you have your floor. About said assistant.
Well, this is now reporting for November, as far as this past month. I've started to include, just as we kind of go through this process of meeting each month, some additional information I think that might be pertinent for the committee's review and for you as well, Mr. Chairman. In this case, in terms of admissions and marketing information I normally provide, in November, the facility had 10 admissions, which on the grand scheme of things has been much higher than what it's been, I think, historically. 6 of those were short-term rehab to home residents that bring in a much higher rate of reimbursement than anything else, which has been for a very long time. That's always, the best benefit for financially for a resident or for a facility to begin with. Of the 10 admissions, there were also 7 discharges that month as well, as far as in November. In October, just to kind of give a brief history before that, as far as the month prior, facility had 6 admissions, and 5 of those being the skilled Medicare with the higher rate of reimbursement, and 3 discharges. So going from October to November, there was a significant increase. This time of year, historically, for skilled nursing facilities, probably across the whole state, as I've always been taught, and experienced obviously too, there's of course peaks and valleys in the operation of any nursing facility, county owned or otherwise. And during this time of year, this is usually a time when we have our higher census, kind of our peaks, not just this time of year, but others too, but especially now as well. Just to give a point of comparison as well, I thought I would start including in year prior data. So December of 2023, obviously long before I was on board, the facility had only 3 admissions, and only 3 of them were Medicare, and only 1 discharge. So even from that data point, from going from December of last year through now, even at this point, we've gone beyond that. We've exceeded even last year's expectations as a comparison. So that's, I think, a good data point as far as reviewing last year now to this year. Moving in the right direction in that way. And when I wrote this report, by the time I submit this to the committee chair, I report the census data as of that day. And then, of course, I'll always report the census data even as of today, which going into the new month, today being, Thursday, December 12th. But the census as of that day was 44. There were 42 that were in-house, 1 that was in the hospital, and then 1 admission was expected that day as well. Today's census was 42 to start the day. 1, actually similar to what it was when I wrote the report. 42 were in-house today to start the day. 1 was in the hospital or is in the hospital, and 1 expected admission for today. So about striking even as compared to when I originally submitted the report. Just looking at the average monthly census for the month prior for November was 43. The average monthly census for October, just to kind of give a couple months here as far as some historical data points, was also 43. For September, it was 41. Looking at also, which was not specifically laid out in the report, but I'll just state this now. The average daily census for December of last year was 37.74. So going from about 38 now up to where we've been around 43, 44 is a decent increase from then until now in this case. And going in, just projecting as well, January of this past January, going into the new year as it was at that time, the average daily census was about 40, with us now going into the new year. Today's only the 12th, so we expect more admissions for the month too. So we'll kind of see in the end for December what the average daily census was, but again, continuing to push higher census. The average type of admissions that we've been taking on the whole, and with the referrals we've been getting from various hospital systems in the area have been the vast majority have been short-term rehab to home. And so those individuals obviously coming in for short-term rehabilitation, and then ideally, in theory, then they would go home. So they don't stay to build up our long-term census, which most facilities, takes a little bit of time, but they develop that as kind of their core census. So the overall census doesn't fluctuate a whole lot because you always have your core of long-term people. And the way that that's built up is a lot of people will come in for short-term rehabilitation, and then maybe they wouldn't fully rehabilitate, and they would need maybe 24-hour care, and then they would stay long-term. So they turn into long-term residents at that point. So that's just kind of a whole process involved with that. But even today, we got a referral for someone that reached out and was looking potentially for a long-term placement just to begin with. And those will happen too. Just so the committee knows as well, I've informed the management staff that, especially to assist our process in filling maybe some of those long-term beds or long-term census requirements. And I didn't discuss this with Mike today, but just individuals that would need to apply for Medicaid. They don't currently have Medicaid coverage, but we would admit them and we would apply them and get them covered through the long-term Medicaid program. Just obviously watching those numbers, making sure we're getting that process and working with the management company to get all the documentation that's needed for that process to get them ultimately covered in the end by Medicaid to help build those long-term census numbers, those long-term beds in this case. So, and with our bed capacity in the facility, as far as how it was originally designed, we have every ability and every capability to fill those long-term beds that need to be filled. So, so just looking at that from that perspective. Also on the report, and as I've reported previously, even when I put together this report, a breakdown of the different census types, and I'm happy to go through this in detail at any point if any member of the committee would like me to. But again, just looking at those traditional Medicare residents that are using that benefit for a short-term rehabilitative stay, Medicaid, the different types of Medicaid. Some people having an insurance company that manages their Medicaid. Some people that have an insurance company that manages their short-term Medicare A, their skilled benefits for rehabilitation, short-term rehab to home. Our private pay as well, those that are self-pay, adding up to our total census in this case. So just going to kind of give that breakdown as I've given in previous months. So just noting that as well. I'll mention this, even though I mentioned it, or it's listed under the miscellaneous items section, as far as admissions and marketing, working through the facilities admissions and marketing director, Jeannie Cross, as far as new marketing strategies for the facility, the placement of a couple of banners in front of the property, communicating the fact that we are open for admissions, that we are accepting admissions, and that also that we offer physical, occupational, and speech therapy. Because again, just kind of seeing the placement of the facility, the location of the facility, the number of people that go down Walnut Road in this case, and people be able to see that, and so that they see as far as the services that we provide. So kind of bring more of a visual to the facility as a whole. Jeannie is also right now looking into a billboard that is right in front of, adjacent to Cub Foods, so kind of a multicolored display board, billboard. Looking at that as far as just for that obvious purpose, as far as marketing the facility in that way. Just putting the word out there as far as the services that we provide, so people drive by, they would see that and give thought obviously to that as far as marketing the facility in that way. So also, I'm going to be working with her going into the new year, doing some lunch and learn programs for, and I'm sure the county health department sees this in the same way. A lot of people that just in the community don't really understand how a lot of parts of healthcare work, even transitioning from a hospital setting to a long-term setting, let alone assisted living or supportive living or independent living. So being, putting a little food out, maybe kind of working with maybe like a food proprietor here in the area, kind of partnering with them to kind of host an event where people would come and myself or the business office manager or even the director of nursing could speak on a certain topic. But I thought we might start by targeting maybe some financial topics because people have a lot of questions. People don't in the community don't always, even my own family, a lot of people, unless you work in the industry, you don't really understand a lot of those aspects work as far as even long-term care to start with, as far as what we do, every day. But just putting out or creating events like that so we can kind of do marketing in that way and getting out the word as far as information, a little bit of educational events as far as what we do and how that works in this case. So I'm working with Jeannie to that end as far as continuing to market in that way and also continuing to work with developing our relationships with our referral sources that are in the area primarily between this immediate area in the Freeport and Stephenson County area. And then also we get referrals from Rockford and then somewhat from the Chicagoland, the outer Chicagoland as well. We get a lot of referrals from like Sycamore, DeKalb area for a potential place. But loved ones or patients that get sent to that area, but they might live in the Rockford area, so they might come to us then too, because they have that more local connection in that way. So I talked to Jeannie as well, just even in my own career in my past, just discussions with me as the administrator, possibly meeting with the I can't talk, excuse me, the CEO of the hospital system here in town as far as FHN, not to mention having a meeting with case management as far as the discharge planning at the hospital as well. Just kind of reestablishing, just even my presence to begin with now that I'm on board and the team as a whole and, what we're trying to accomplish and what our capabilities are at this point as a facility. So as far as marketing strategies and systems that we're putting into place at this point, continuing to develop that going. So just noting that as well. So under personnel, something I wanted to start adding into this too was just kind of give the committee membership as a whole as far as our number of active staff. We have 62 active staff employed with the facility. So 62 county employees with the nursing home at this point. In the month of November, we had, as I've reported in previous months, we had 5 new hires with the facility and 4 terminations. 2 of those terminations were voluntary and 2 of them were involuntary. So just noting that as well. Not even just with long-term care facilities, but I'm sure as everybody in this room can kind of speak to, employers of all kinds or, deal with a lot of personnel issues at this point in terms of, people that don't show up to interviews, people that just kind of ghost their jobs, people that just stop showing up. So we're trying to work, the HR director, Kendra Martinez, and I are trying to work to address that, to combat some of those once they're on board with us. She's kind of acted in recent months as more of a staff development coordinator, working with on our onboarding processes. She's going to be doing some, even though she's not a nurse or a CNA or even a housekeeper or laundry staff member, but she's going to be working with those staff to kind of allow her to be trained so that she can learn our training and onboarding processes so that we can kind of see what we could do better in that way. They'll teach her, they'll work with her and kind of pretend like she's an orientee so she can kind of work through that process and see how we can handle our new hires, better and do a better job keeping them on board as a whole. So just noting that as well, other employee recognition programs, as far as what that is, as far as programs we're putting in place for that as well. Under the regulatory section, number 3, again, at this point, going into December, we are at any time.
He's got a question.
Oh, I'm sorry.
The employment end of things, what do you consider is your most difficult competition in the area for employers or employees, I should say?
Yeah. As far as like, you mean
the
other
landscape, I mean, you got LPNs, RN, all these different folks that you need skilled personnel. I mean, do you consider the hospital? Do you consider other nursing homes? I mean, what? When you
hospitals
look at the general
hospitals
area,
are always probably one of the biggest competitors to overcome in that way because they have more resources than nursing homes do. They can hire, typically higher rates of pay, I would say, as a whole. But long-term care facilities are next. Our competitors here in the immediate area, not to mention those that are in the region, in the county, or just in the region as a whole. And there are different things that go into that too. Um, that gives us any sort of competitive edge to be able to hire people. So I would say hospitals and then other long-term care facilities, assisted living facilities and supported living facilities like Oakley Courts or Wind Prairie here in the area. Those are either Medicaid subsidized or just private pay, and so they don't pay as much. So as far as rate of pay, we don't typically compete as much, probably in the same way with them. Independent living facilities, even less. So as far as from a healthcare standpoint, probably hospitals and then other long-term care facilities, I would say.
Thank you.
Mhm. Under the regulatory section, again, going into December now, as the annual survey, the annual health and life safety code survey took place in January of now this current year. We're now expecting that as well. So as we go into each new week, as far as going into a Sunday or a Monday or even a Tuesday, as it's been my entire career, we just have get ourselves mentally prepared for the survey team to walk in, to be able to kind of assess and analyze how we're doing in every area. Keep in mind that the facility in January had a fairly good outcome. There were no deficiencies or violations that were of any high scope or severity. Granted, there were things that they did cite, even in terms of the inspectors walking past, nursing staff that maybe should have had their computer locked, so that visitors can't see their computer screens to be able to see, electronic health information, for the residents of the building. That was a low-level citation, but the building did get cited for that. So it just really depends on what they're looking at, and every annual survey especially, is different. So we, again, just getting prepared for that at this point. I expect similar results. Even in the short time that I've been on board now, and from what I've seen as far as how I feel the staff will respond, I expect similar, if not better, results for the annual survey. So it's just a day-by-day process once we go into that, just to manage that as far as what that is. So we'll just kind of take that a day at a time, as I always would anyway. Under number 4, as far as, and this also incorporates the maintenance director's report, there were no significant items of note on his report. I'll call it the continued saga as far as the heating and cooling systems. That work was officially started yesterday. Loescher came to the building yesterday. They've been actually coming to the building to kind of get prepared for that project, for the installation of the 2 remaining rooftop units, or units on site. So that officially started yesterday, Wednesday. So this is going to be interesting. They're going to be doing the north part of the facility first. When you walk into the main entrance of the building and you go to the right, the area that was already affected anyway, but as far as air conditioning, they're doing that area first. And I've been kind of going down there and kind of watching how they're doing things down there. And then they're going to do some work on the south end of the building. So the north end of the building is the Oakwood initial area nursing station, and the farthest end is the dining room is the Birchwood area. And then on the other end, the south end of the building, is the Willows, the dementia unit, and then the Redwood area, which is the farthest out. The maintenance director calls that the Y wings, because they split off into a Y at the end of both buildings. So, we're kind of today's Thursday, so we'll go into this week, go into the weekend, go into next week. So there is every possibility they could finish this work by the end of next week. So I'll be kind of watching over there to kind of see what direction that goes. So that's pretty much what that is. So that will bring up that will put an end to that project as far as what it's been. That's been, in process probably this whole year. In different forms, from when it was signed off on and when they were going to get started on it and all of that.
Air conditioning next week.
Yeah. Along with that, just to note, one of the in the capital funds, not the 003 operating, or I call them the operational funds, but in the capital fund, that I met with the county administrator, the chairman of this committee, and the finance director with regards to other funds that are available that were set up since the beginning of the year, maybe. As far as covering certain, I guess what I would normally call maybe capital improvement projects related to this work that we just talked about, related to a water heater as well, that I think it fell under the same category. The water heater, I went ahead and ordered that to be done as well. So they went ahead and got that started. That affected the Birchwood, which is on the north end of the building, the Birchwood area. So that could be finished as well. Just a note to the committee as well, and to everybody as a whole, because of the work that is being done to finalize this heating and cooling repair, it's going to cause a situation where we have to relocate residents at least temporarily for at least 3 days from the south end of the building, which is where the residents have been living since I started anyway. But I'm actually taking this as an opportunity to divide up the building to be able to kind of what's the word? Create different programs in the building so that when you go in the main entrance and you go to the left where everybody has been, to the first section of that nurses station, that's where the Willows dementia unit has been. And as I discussed with the committee and I discussed with the management company, I have every intention to reoccupy that. Because I'm fairly confident we can fill it. And I was talking about long-term bed admissions, which we need to increase as a whole. That's a 24-bed unit back there. That would help. I mean, if we could fill that fairly quickly, compared to what we have been as a whole, we're just taking in mostly short-term admissions. That'll be a good bulk or good boon to our overall census. So you're planning on utilizing that in that way. The main hall there on the left that goes to the Redwood area and Willows area, still using that as a Medicare area for private suites, which most long-term care facilities have been using or attracting potential admissions with private suites. And then a small hall that just kind of goes off to the left as well. So the only halls that we will be moving residents off will be the back short hallway where medical records has been in the beautician office, and then what I call the long dining room hallway, basically the Y wings on the north end. And then when you walk in the building and go to the right, which is where we had the air conditioning issues, the Oakwood initial area there is we'll put long-term residents, relocating them, basically splitting the building in half. And some of the logic that I had with this was with any building structure, I don't like leaving a section of the building unutilized because you stop using the systems that are down there and things can tend to deteriorate over time. So this will give the ability twofold to be able to keep those systems healthy and then to also be able to monitor residents because we have residents that are, affected by different mental conditions that maybe wander around the facility that would go to that part of the building and nobody would know, potentially. So this would also allow for additional monitoring on both sides of the building. And then we would just grow both sides from there, both short-term admissions on this side as well as our dementia care unit, and then our long-term area on the north end of the building between Oakwood and Birchwood. So just so the committee is aware of that change that I have made. That's as far as maintenance issues. God help us. There's been no issues as far as the generator or anything like that we had maybe a few months ago. Just to bring to the committee's attention too, this was also part, I think, of maybe one of the capital fund intentions for one of the capital funds this year was the window units. We had talked about that previously, but unfortunately with the HVAC repair that had to be done, it came out a little bit higher than maybe was originally planned for, and for the water heater, I think with that too. The amount of funds available as a whole in those capital funds isn't enough for everything. So, as it is, we'll make use of what we have and we'll hit the priority item. One of the items that was originally listed was the windows in the dining room, because as I'm told from the people that have been there, that those dining room areas at the end of the building there's such a wide and big area that the cold does really affect them. And those windows are, a little bit old, and so at some point they will need to be replaced, at some point sooner rather than later. So the building combats that as it has probably for years at this point, as far as just keeping those areas, warm at this point. So as needed, we serve residents in the activity room and kind of the central administrative section as needed, but we just kind of manage it on a day-to-day basis in this case. So just throwing that out there as well. As far as our committee, our safety committee, there were, again, just God help us, but no continued issues with workplace injuries or workplace hazards. However, I will tell the committee that one item that has been brought to my attention is the back parking lot of the facility. That because of the condition that it's currently in the wintertime, when water builds up in the back, at least as I've seen it for myself now, this is my first winter here, obviously at the building, creates kind of an ice rink back there. And so it creates difficulties for, sometimes for staff. I'm thinking of slips, trips, and falls in winter weather. So just noting that as well, as far as what that is. So that may have to be addressed, sooner than later as well. So just noting that. And as far as miscellaneous items, the facility has been dealing with, and I think Mike can probably speak on this further than I can, but as far as the industry as a whole outside of Stephenson Nursing Center, as far as audits related to reimbursement, review of documentation for different resident stays, both short-term and long-term, basically making sure that we crossed our T's and dotted our I's, and if we didn't, then potential, recoupment of, different amounts. But there's no major concerns at this point in terms of any of that. The management company is helping us triage those. Their reimbursement expert is helping us triage those as far as, making sure that the insurance companies are getting the information that they've requested and getting those submitted on time. So I mentioned those before, but I'll bring it up again since they are still continuing. And as mentioned before, also going into the new year, looking towards another point of excitement is a potential VA contract, as we've discussed with this committee in the past. Again, as we said, I think maybe in the last month, looking towards March as a potential contract date. So going into January now, at this point, today being the 12th of December. So that'll be a good thing. And we'll be able to serve, especially, as I said, I made these changes in the building, we can utilize the north part of the building, the Birchwood areas with the Y wings to be able to, as far as those potential long-term halls and long-term beds for potential veteran placements. So we'll have an area potentially for them once we would start getting contracted and be able to admit them as well. So that's a good thing. I already mentioned the dementia unit, the Alzheimer's dementia care area, which we will reoccupy and we will use for that purpose, because again, that will be a big, good boon to our overall census. And then I mentioned outpatient therapy as well. Once we get to the point with therapy company that we're more solidified with renewal rehabilitation as far as their staffing in the area, which has been much better than what it was with Powerback, which was who was in place when I came on board. That's been an improvement, and the residents have been overall happy and satisfied with the therapy services that have been provided. So we'll continue to work in that way as well. And then a final point of note is this month, as far as holiday events for both staff and residents, there's actually an event tonight going on right now as I'm sitting at this meeting. For the residents in this case and their families, and of course also having Christmas luncheon on Christmas Day, events for staff on Monday, the Monday before Christmas, or the Monday the 23rd, as far as appreciating our staff as a whole, as far as what that is. So, and then going through the New Year's Day as well, going into the new year at this point. So I will say, for what it's worth, just as a point of record, that in the time that I've been on board, serving as the interim administrator for the facility, I have to say that, just again, as a point of record, that I have been very pleased. This has been a very positive experience, and working with this county board has been a very positive experience as well. Even members of the county board who maybe didn't know me as well and maybe aren't on this committee have even come to me and expressed gratitude for what we've been trying to accomplish, and I felt very well supported by this county board for what it's worth. So, including the county administrator and the county board chairman. So, just speaking to that point, it has been a very positive experience so far. And if ever chosen eventually to serve the county in a permanent capacity, I would definitely accept that opportunity if that were ever to be the case. So, just noting that as well. So, as far as this month in review, I think that's all I had for this month. So,
Perfect. Any questions for Marco?
Thank you.
Howard?
Yeah, Tim, did you want to go first?
No,
Or?
sir, I just said
You said thank you.
Oh, okay. Just to follow up, I've heard nothing but positive feedback from the employees, from family members, and from the residents out there. What are we doing? Oh, you've been with us since
July, I started coming.
July, so you've been a little over 5 months with us now. What is this committee like? What are we going to do about looking for a permanent person? Because I think he's doing an outstanding job out there, and I think that we should try to offer him a contract, and see if he would accept that, because we're paying agency fees right now. We're paying for lodging, so it's costing us a lot of money compared to if we hired him permanently and stuff. So I'd love to see this committee do something next month about, I don't know if I doubt it's got to go through the interview process, because he's doing an outstanding job for us. So I'd like to see this committee act on something, with a contract in front of us and stuff like that. And one of the most important things, that if we do a contract with him, that he gets in one of these service organizations and gets involved with the community. I believe our county administrator's in Rotary.
They took that out of my contract at renewal.
Oh, okay. Sorry to hear that. So, being part of the community where he could get established and have residency here and get involved with the community more. So I'd like to see us take some kind of action on that here in the near future. I think he's doing an outstanding job.
Anybody else have anything for Marcos? All right. 7.2.
Let's see, let's start with the October P&L. Month of October, we actually showed a profit of $10,098, which was tied to a little bit higher census, 40.5 to 42.6, and some lowering of expenses. We're still at brings us to a loss of the year though of $84,956. Would expect November, that's guess, because there's a holiday there, to be more in the break-even range. Starting December 1st, starts the new insurance policy for workers' comp, professional liability, property, and the nursing home portion of that annual cost went down $165,000. That's approximately $14,000 a month, which will start being reflected in December. That'll certainly be a help, not just for December, but for all of next year. Any questions on the P&L?
What's the current census? I have a sense on one.
What's that? I'm sorry?
42.
42 in-house. Actually, with one hospital return today and a new admissions 44. So going into tomorrow.
Let's move to accounts receivable. Show overall accounts receivable of $1,150,810.02. The over 12-month and over category is totally coming down, 296,486. And I thought about you on the way here today, Tim. I know we've had the discussion about the 90 days, and it's kind of like the reward day. So I'm thinking to myself, Mike, what can show Mr. Whalen? And so it did dawn on me, maybe in between this meeting and next, but it'd be interesting to show you how much of the dollars outside of that 90-day period. And so the majority of it, we're getting, in chunks within the 90 days, but the things that start to slide past 90 days, I'll just give you one example. We just got about $4,000 in it for something that was 9 months out. If after the 90 days, for whatever reason, fine, we had to reply, do certain things. And so I think that, if we did a graph like that, that showed, of the dollars that don't get collected in 90 days, when do they get collected? It might give them a better picture of what that right mark is for this building. Trying to move everyone off the 90-day mark. Maybe it's a 20-day mark, 50-day mark. But I think, we can do some report that'll be enlightening. That's why you don't give up after 90 days would be the theme to it. But I think it'll show a little bit different discussion point.
That would be interesting to see. I think, the thing I don't understand, Mike, when I hear Marco say that we're going through making sure all the data entry is correct, because in my discussions with other administrators throughout the state, at times when I've had the opportunity, it seems like that's the key. In fact, if all the information's input correct, and we've got the right company billing, we got all this stuff lined up properly, we get reciprocated and paid in a timely manner. And so it just makes me question in my mind, is that all really getting done correctly? Because we're still sitting here, quite some time after TCM started doing the billing, and it doesn't seem to be aligned properly. in my view, again, maybe you have a report that could show why that is, but there's no business in my mind on this earth that you can run when you've got AR that hangs out as far as we do. I don't see how you get cash flow. It just isn't possible.
I mean, I know we've had part of this conversation.
I know.
Part of what the
We can go round and round about it.
Hopefully we can put something together that will, lighten all of us a little bit more. Be talk a little bit more specifically.
Detail is always good.
Cash flow. I mean, basically, I know we came from a world where you'd see like a high in the month. You look at the treasurer report, a high 1,350,000, 1,400,000 and payable. And then on the low end of the month, it'd be $1 million. We have moved to, and we get the reports, to a range of $1 million being the high end now, 750 or so being the low. There's definitely been improvement in 12 months. But it's a slow process. There's a census of 42 and, scraping out $10,000 in 1 month. So, the higher we can get, the quicker we get the census higher, we believe that we'll be able to get that down to 0 one day. On another note, talking about cash flow, wanted to inform everyone at this meeting, a few weeks notice here that TCM is planning on January 2nd, sending in a cancellation termination notice for just cause, which will be spelled out as lack of payment returns. There's a 10-day cure period in which, you can catch up. Wanted to let everyone know that here, sometime now and then, phone is on. Meetings and conversations about a year. If you don't understand this, that's all I have.
Okay. Any questions for?
Yeah, I do. What he just said kind of concerns me, and is this something that maybe finance can take up on Monday, to at least discuss that in finance committee? Because what was the date you said that you'd officially be out the door?
January 13th after the cure period.
13th, that's before our board meeting in January, so any type of action we take, I mean, this looks like finance needs to look at something yet this month. And
Well, I would question the idea. I mean, if we look at hiring Mr. Marcos full time, and he takes over the management responsibility, then I think the role that TCM would play change anyway. Because at that point, we may need some billing support from the company. We no longer need their services to manage the facility. So I think that's a broader discussion than just, I didn't expect Mr. Filippo to present that tonight, but since he has, I guess we'll have to take that into consideration. Think about that. I don't know if finance is the right spot to start that discussion, but we may have to do something.
I believe the amount is, if I looked at the paperwork our treasurer sent out, was about
It's
358,000. I mean, could we advance some of the 500,000 of our levy next year?
Mr. Hadley, what is our AR?
So I'm just, I'm not sitting on financial, just asking for, giving ideas,
What did we just hear our AR is? $1.1 million. If that money was in, we would have plenty of money to pay TCM. That's been my contention for over a year. I think it's all there in black and white. That's all I have to say about it.
8.0, new business, no new business, 9.0, old business. 10.0, sir, the public comment from you, if you have one? Nope, all right. 11.0, adjournment.
Second.
Introduced by Mr. Whalen, any discussion? Seeing none, all those in favor say aye.
Aye.
Motion adjourned.